we're going to do a lower eyelid AccuTite procedure and an upper eyelid procedure using an internal probe that is going to heat the tissue and create tightening of the lower and upper eyelids, and also remove the fat pockets at the same time without needing surgery. So there will be no scarring on either the outside part of the eyelids or internally in the conjunctiva, and there will only be a little needle puncture that will heal invisibly. So with the AccuTite procedure, we're targeting both tightening and removal of those fat pockets under the skin. Then we're going to do a Morpheus 8 treatment afterwards to further tighten the skin externally. To start the procedure, I've marked out the area of the fat pockets under the eyelids here, and if we push gently on that upper eyelid and eyeball, we can see that herniating through that lower eyelid skin, and that is what we're going to target with our internal temperature probe. So first, I'm just going to make a little needle puncture here laterally on the skin, and that is where we will slide our AccuTite probe through. And I'm just tunneling here a little bit to create a channel for that probe to make its first pass more easily, and then once it's through, then it's very easy gliding along the procedure. So here we go with that, and then once she's done with her first Morpheus 8 treatment today, we recommend that she come back every 3 to 4 weeks for another 2 to 3 sessions afterwards, and then she can maintain periodically into the future with just the Morpheus 8. Now here I'm applying gel to the skin first, and that is required for the RF to work. The probe is now gliding right under the skin. I'm going to make sure that we're right in the fat pocket, and I also want to make sure that the depth of my probe is perfect. And now I'm delivering the heat into those fat pockets, and this is actually going to cause those fat pockets to melt away and also give a nice tightening effect to the skin at the same time. So that side is now completed. Both the lower and the upper eyelids have been treated. You can see there's a little bit less fat herniation. We're just going to touch up a tiny little bit at this point just to make sure that it is exactly where we want that to be, and then we will move essentially to the other side. And in this case, with this patient, I also ended up doing a tightening of her brows at the same time. So she is going to receive both an eyelid tightening, improvement of the fat herniation, along with actually a lift to her brows directly. So here I am making an access point for the brow lift, and we will use the same kind of method here. We'll put the little AccuTite probe. It is so cute. It's really a lot of fun to handle. It just slips right under the skin, and it gives really targeted heating at a very specific temperature, keeping it very safe for not causing any burns and giving us the results that we want. But this is a beautiful procedure for a brow lift. Absolutely my favorite right now. Pretty much minimally invasive, but hardly any downtime. There is some swelling after the procedure, but not too bad, and the patients tolerate this really well. It's all done under local numbing, so you don't really feel the procedure, except for a few little pinches here and there, but really well tolerated. Now we're going to do an upper eyelid tightening here. Using the same probe, I am going into that upper eyelid using the same method here to make gentle strokes across the skin. So there are two places the RF energy is coming out through, primarily through the probe on the inside, and then the external probe sits on the skin and measures the external skin temperature, and we want that to be at about 42 degrees. The internal temperature is a little bit higher. And now we're treating her other side here, so you can see the probe just sliding in again. We are at a good depth, at a perfect depth for capturing those fat pockets, and then just a nice smooth action to get rid of those fat pockets. So here we have some really nice tightening happening, and you can see that she's tolerating the procedure extremely well. And here is a view of the other side of her brow lift. So again, some gel to the skin for the RF, and we've made our little puncture point, and the probe is sliding right under the skin, and we can go ahead and firm up that tissue, build new collagen, tighten it up. It almost happens instantly, some of the tightening, and then of course you will continue to see more and more improvement actually over 4 to 6 months after this procedure. And a lot of times patients couple this with an external Morpheus 8 treatment, which is also radiofrequency, but little needles that actually push into the skin and then deliver the RF deep into the tissue. So that is another way to get some good maintenance of this area. And here we are treating the other upper eyelid skin. Again, contouring as we go, tightening up all that tissue. She's going to love this. It is like doing an eyelid surgery, but without having any sort of surgery at all. So that is the procedure. It looks a little scary, but honestly, the patient's not feeling anything at all. The probe is very small, about the size of a larger needle, but blunt. Very safe procedure. Now here I am doing the Morpheus Prime treatment. For this, the skin needs to be completely clean and devoid of any surface creams or gels, and the needles poke right through the skin and create those little micro wounds. So it's great to do this in conjunction with the AccuTite procedure. And then again, she should come back every month for the next couple of months to repeat the external treatment. And then she can do that periodically to help maintain herself. This can, of course, be done anywhere on the skin. The rest of the face could also be treated. We're seeing some really nice jowl lifting and neck tightening with the Morpheus 8 procedure. We can also do AccuTite around the mouth folds, what we call the nasolabial fold. Sometimes it looks really heavy in that area, and we can take that little cute probe right under the skin and tighten that nasolabial fold area as an alternative to dermal fillers. And sometimes dermal fillers really don't take care of that fullness around the nasolabial folds in terms of eliminating or lifting that out of the way enough. So that's another nice application of it. We're also seeing great improvement in skin tightening to the abdomen and the arms, using both AccuTite for smaller areas, and then BodyTite is basically the same procedure but using a larger probe that is more well suited to the body areas, and then also using Morpheus 8 over that for further skin tightening. Morpheus 8 can of course also be used on its own for skin tightening as well. So hope you enjoyed watching this procedure. Hope it took a little bit of the mystery away. I know it can look a little bit scary, but the patient is completely numbed, and there will be a little bit of swelling, but again, just no scarring, and that in itself is so amazing, that you can walk out and have a procedure like this, improve your fat bulges. We have a lot of different options, a lot of different procedures at our office. We always like to do a real personalized consult to make sure that you're the best candidate for what we're recommending. So please do come and see us. Thank you so much for watching.